Joining me now is Cheryl Chui, Director of Health System Analytics for the Canadian Institute for Health Information. Thanks so much for joining us. So Canadians are waiting longer for some surgeries now than before the pandemic, even though more surgeries are being performed. Talk to us about some of the reasons behind the increase in wait times.
So many factors influence wait times, including increasing demand for procedures like hip and knee replacements and cataract surgeries. What we see from our data is that the population growth and the aging of the population is increasing the need for these surgeries. We also see that other factors such as health workforce challenges that were exacerbated by the COVID-19 pandemic are also playing a role in how long Canadians are waiting for procedures.
So ultimately, what are the consequences for these delays on patients?
For patients, we know it can be quite difficult to wait, especially if it's longer than the recommended time frame for your surgery. From talking to patients, we know that waiting can lead to increasing pain, decrease in quality of life, sometimes the inability to work, and there's the added stress and anxiety of waiting for the procedure. So what we're hoping is that by reporting on this data, we can provide some transparency on wait times across Canada, as well as a bit more information about the factors that influence wait times and what provincial health systems are doing to address wait times.
So what do you hope can be done to address these wait times? What immediate actions should be taken to reduce them?
So we know that provincial health systems are employing a number of different strategies, including streamlining processes for patient intake and booking, carefully monitoring and managing the wait list to ensure that patients are prioritized appropriately, as well as using alternative care settings for surgeries. So for example, we saw a dramatic increase in the number of hip and knee replacements performed as day surgeries, that is surgeries that don't require a hospital stay afterwards. So this rose from 1% in 2019 to nearly 3 in 10 patients getting their hip or knee replacement in day surgery. So these are different ways that provinces are trying to increase the capacity for surgeries and address the wait times.
Cheryl Chui is the Director of Health System Analytics for the Canadian Institute for Health Information. Cheryl, thanks so much for your time today. Appreciate it.